Here at George Mason College of Public Health, we're thinking about intimate partner violence as part of Teen Dating Violence Awareness Month. And here with me is an expert at our college, Dr. Daphne King. Dr. King, thank you so much for joining us to have an important conversation.
Thank you for having me, and yes, this is a very important topic.
Tell us about teen dating violence and how prevalent is it in the United States as far as you know?
So when you look at data from surveys from the American Psychological Association, the CDC, as well as the Teen Youth Behavior Survey, it shows that roughly about 19% of students or youth experience dating violence in their relationships. There isn't any significant data to show any disparity across ethnicity or racial lines. So really all teens, regardless of their backgrounds, are experiencing some form of dating violence for those that are engaged in dating relationships.
My bet is that a number of people seeing this are going to be surprised by those numbers. Can you help us understand what are some signs that one should look for to understand that this is happening?
So with the warning signs, they tend to also look pretty similar to warning signs for other at-risk behaviors or for other types of mental health concerns. So things like withdrawing or isolating from friends, unexplained bruises, not engaging with family and friends, showing signs of depression. And those are all signs or symptoms for things like depression, anxiety, suicidal ideation. So really parents being aware of what their teens or adolescents kind of baseline or typical behavior is, so that they can recognize when some of these things are occurring and they are not the typical for their teens' behavior.
That sounds like some really important warning signs, even though very subtle. How can parents and other adults be involved in prevention and supporting teens who might be in this situation?
It may be a little surprising for some, but parental involvement is the primary protective factor. And I know sometimes when I talk to parents and teens in practice, sometimes parents are a little bit surprised that their involvement in their teen's life can be such a huge protective factor. But really engaging and having those conversations, knowing what's happening with your teen, knowing who their friends are, and just having organic, honest conversations is a real protective factor for teens.
Such great advice. As parents, we're always wondering, too tight, too connected, too removed, and I hear what you're saying, that connection can really be an important buffer and protection. I wanted to ask you about what should teens know more about this? What can they do to prevent it? What would you like the teens to be aware of?
Teens really should understand and have some knowledge of what a healthy relationship looks like. And that does go back again to parental involvement and parents modeling for teens what a healthy relationship looks like in their own relationships, family interactions, modeling that mutual respect and trust. I think teens should understand that their bodies are their own and that they have a right to say no. They have a right to not engage in activities that make them uncomfortable. I think teens should also recognize some of the signs of someone that may begin to perpetrate dating violence or domestic violence against them. And one of the things that teens are not always aware of is when someone is constantly tracking them on social media or wanting to have access to them all the time via text message. In some instances, some teens may think that that's cute, that the person is showing them attention, but they have to understand when it crosses that line into the person is, really trying to control you and control your movements.
Really overstepping healthy boundaries.
Yes.
We so appreciate your expertise in this area and your willingness to share this knowledge. I think thousands of viewers are going to be really informed by this conversation. Thank you very much for your expertise.
Thank you for having me.